Welcome to Sense and Sustainability, an organization dedicated to providing rigorous but applied perspectives on sustainable development. You're listening to the SNS podcast. You can visit our website at senseandsustainability.net, where you will find an archive of all previous podcast episodes in addition to our latest publications. Thanks for tuning in.
Welcome back to Sense and Sustainability. My guest is Dr. Abdul El-Sayed. He's here to talk to us briefly about his time in the hospital, some of his thoughts about the medical profession in general and medical school, particularly aimed at our listeners who are, either undergrads who have an interest in public health, pre-meds, looking to go to med school, current medical students. Abdul and I thought that it might be nice to share some perspectives from the road of public health. Abdul, as our good mutual friend Don Markwell likes to say, the worst vice is unsolicited advice. But we'll assume that if you're listening to this podcast, you've implicitly solicited Dr. El-Sayed's advice on med school and public health. So, Abdul, in your mind, what were some of the biggest differences between what you and many other undergrads probably imagine when they think, hey, I'm going to become a doctor in college, and what you ended up facing in medical school?
But first, before I say my piece, I have to say that there are aspects of the practice of medicine that are absolutely unique to medicine. You get a front row seat at the play of life, and you see things, and people let you into their lives in ways that you absolutely will never be let in any other way. And so in that sense, when I talk about medicine and some of my my skepticism around the career choice, that's notwithstanding the recognition that it is a very unique specialty and a very privileged specialty.
Yeah.
And the many patients that I've had the opportunity of seeing, I'm deeply humbled and deeply grateful that they've let me into their lives in that way. So this is not a reflection on them, but more a reflection on the way that medicine has become. And in a lot of ways, my own frustrations have actually been counterposed to what I understand to really be the competitive advantage of medicine, which is that humanism. And in so many ways, I found myself, rather than seeing patients all day and thinking through interesting scientific questions, I found myself pushing paper and having to be protectionist and taking care of some attendings billing and
right.
Doing all of the things that seemed so antithetical to the reasons that I got into medicine. And those are because I really love people and I really love science, and I saw medicine as an opportunity to use my love of science to serve my love of people. And unfortunately, I found that more than anything else, I became misanthropic and angry about the way that the hierarchy was treating me and other medical students, and more importantly, how patients really got forgotten in the mix. And so for me, I've always preferred a 30,000-foot view. And so I really yearned for my time as a PhD student thinking about big picture problems, health systems level problems, problems with respect to what causes health and disease in a population. And I also realized that while I enjoyed and worked hard at medical school and did well, I was more attuned and interested in that 30,000-foot perspective.
Right. And let me just add on to what you just said, Abdul, that, as your friend watching you go through this process, at no point along the way did it seem to me that, you were not aware of this, as you put it, this privilege and the ultimate humanistic intention behind the medical profession and almost everybody who enters medicine, capital M. Yeah, but I did also notice what seems to be institutional failings that manifest themselves in frustrations not only from you, but also many other of our mutual friends, right, and folks who are in medicine. I mean, we did a podcast with another Dr. Lena Wen, and the title was When Doctors Don't Listen, and the whole conversation was about how the institution forces doctors into a role where they just don't have time or bandwidth to actually listen to the patients, which must be frustrating for people who entered the profession because they care about the people ultimately. So let's try to focus this conversation toward advice that might be relevant to budding pre-meds or current med students. I mean, any pieces of advice that you might give in terms of how about good and bad reasons to go to med school?
Yeah, certainly. So, like I said, medicine is a very privileged field where the opportunity to touch somebody's life is unique. And if you can't see a life without taking care of patients, then you should go to medical school. For any other reason, whether that be because you have an ancillary interest in the healthcare field, or you're interested in health as an academic enterprise, or you're getting family pressure to be a doctor, or because it's a nice lifestyle with good money and it's stable.
Right.
None of those reasons are actually good reasons to go to medical school. There are a number of other fields that can give you any of those things that are not as number one, as difficult in terms of lifestyle and time and pressure. And then number two, can be equally rewarding and equally influential. Oftentimes we think about doctors and say, well, there's no profession that touches people the same way doctors do, or is as impactful. Medicine is impactful, but it's impactful one patient at a time. And so if you're interested in big picture questions that shape the way that we think about issues, medicine really isn't the way to go for the most part. There are other fields that allow you to do that in a much more direct and focused way. So if you really, really like caring for people and you like to use science to do that, again, it's not completely scientifically focused, but you like to use science and you really want to take care of people and you can't see a life without taking care of one person at a time, then I think medicine is the right career for you. If you want to change healthcare, if you're really passionate about thousands or millions of people at a time, about communities, and about thinking through why it is that we do what we do, I recommend thinking around ancillary careers, whether that be getting involved in the business of healthcare, or in my case, thinking about healthcare in a more explicit academic type of way. It's not like the olden days where the only way to be involved in healthcare was to be a doctor, right, or to be a nurse. There are many, many more ways to contribute, and many of them more impactful than medicine is.
It's a big enough industry, I think, and growing, to say the least. Let me get you out on this question. We fielded some questions from some of our listeners, and this one comes from someone who's interested in your experience in medical school and working in public health. And this has to do with the institutional shifts. Do you see a shift at all in medical education, right, or in the selection of med students toward primary care or working on more preventative public health oriented issues? Or do many still want to pursue the more highly specialized fields, such as surgery, that has always been the case? What's your take on that?
So I think a lot of medical schools are thinking bigger picture about training students and giving them the skills to be effective on a community level. But fundamentally, medical school is about learning how to diagnose and treat disease in individuals. That's what medical school is about. That being said, increasingly you're getting brighter, more talented students who are explicitly focused on primary care careers. Not that wasn't the case in the past, but I'm seeing a real resurgence in that, a community medicine focus, which is reassuring.
Right.
That said, fortunately, when you look at the numbers, students with the higher test scores on average tend to go to more competitive specialties, whether that's a selection effect because they want to go to those specialties and work hard because of it, or because students considering, at the end of the day, considering their options, go for where the money is. I mean, it's no secret that surgeons and more highly procedurally based specialties make more money, and so it's unclear. But I hope that more bright young folks who are interested in the community influences and implications of medicine take the primary care track and really commit themselves to that. It's part and parcel of producing the type of health system that we talked about that we need.
Well, I think that's a good place to end it. My guest today has been Dr. Abdul Sayed. Abdul, always great to talk to you.
Always a pleasure, sir. Thank you for having me again.
Have some thoughts you'd like to share about today's podcast? Please let us know by posting them online at senseandsustainability.net or emailing us at senseandsustainability@gmail.com. We'd love to hear from you.